profession. Now, one of the major characteristics of medical humanities is that it closes the gap between science and experience, science and human experience. That's what I would say. This is one of the primary, objectives of medical humanities, to bridge that gap between science and human experience, which means it relies on the philosophical distinction between disease and illness. So medical humanities distinguishes between disease and illness. For us, they may be one and the same, disease and illness. But for medical humanities, disease is something else, illness is something else. And this is, this is something that medical humanities draws from philosophy, actually. It's a philosophical distinction between disease and illness. Disease is what happens to the body and is understood through science. Illness is what the person experiences and is understood through eliciting patient stories, as well as by asking questions such as, what has this heart disease done to your family? You remember, we started off our discussion with this question. I started off, this session with this question. What has this disease done to, your family? Such questions. Or you talk to patients, you elicit their stories, their experiences of not only the physical pain, their experiences of emotional, psychological trauma, their experiences of the behavior of family members, their experiences of the people who visited them, their behavior. All this, so patient stories. You elicit patient stories, and through all these questions and such stories, you understand illness. For medical humanities, so illness is what the person experiences, whereas disease is what happens to the body, and it is understood through science. There are also other approaches to create a bridge between science and medicine, which include reading stories about illness. And also pathographies. Pathographies are narratives of illness, actually. Or watching films and theatrical representations of illness. Or viewing paintings and sculptures that represent the body in pain. Bodies are represented in pain, even in paintings or sculptures and so on. So in medical humanities, a significant theoretical question about the relationship between science and experience is whether medical humanities ought to be regarded as integrating science and humanities in medical education, or whether humanities simply should be added to a largely scientific medical education. No, the question is whether you have to integrate science and humanities in medical education as inseparable things, or you include, just as you introduce a second language or a first language kind of thing, one course on literature or humanities, whether that would solve the issue. This is a pertinent question that medical humanities continues to raise. And medical humanities scholars would go for the first one, that is integrating humanities and sciences in medical education. Now, let me quickly turn to the link between literature and medical humanities. It's almost 40 minutes now, I suppose. How much time do I have? Shirisha ma'am, how much time do I have?
So please continue, sir.
Okay.
Continue for now, sir.
Okay. So let's now quickly talk about the link between literature and medical humanities. Now, reading narratives of illness and stories of doctoring, doctors' stories or narratives of illness, and treating, and also treating. If you read stories of illness, narratives of illness and stories of doctoring and treating, all these stories, it expands our minds and sensibilities, and it deepens fellow feeling. Now you develop an understanding of patients, how to approach patients. That's a basic idea within medical humanities. And therefore, literature becomes a significant tool for medical humanities. That is, narratives of illness, stories about doctors, stories about treatment, and so on, can actually develop or expand our mind and sensibilities. And also, it deepens fellow feeling, according to medical humanities. Whether through poetry, fiction, or a memoir, you vicariously experience what others have undergone. So that feeling, when you experience what others have undergone, it illuminates and widens our knowledge of experience of illness, particularly. So in this sense, literature and the arts turn out to be a learning laboratory, you can say. It becomes a learning laboratory from where medical professionals can find the lives of the ill, their hurt and anxiety, and though however imaginative it is. These stories might be imaginative, definitely. But the feelings of people who fall ill, feelings of patients, that becomes a source of knowledge for medical professionals. In a medical humanities perspective, we may ask why sickness prompts us to storytelling. Many people, we all know, many people wrote wonderful, works when they were sick. We know that in the history of literature, right? When they were not well. So, what prompts someone to write or produce literature or start telling stories, start writing stories while they are sick? What is that connection between imagination and illness or sickness? That's something that medical humanities is curiously interested in, asking this question: why sickness prompts people to writing, or how popular media influences our views about what it means to grow old or live with a disability. When you see that on popular media, representations of the disabled, representations of old people, and so what it means to grow old or live with a disability, or to practice high-tech hospital medicine, or why it's important for doctors to strive to merge medical and humanistic sensibilities. So reading literature, reading narratives of illness, would actually help you ask such a question as well. Why is it important? Or you would find that it is important for doctors to merge medical and humanistic sensibilities. So medical humanities inquires the ways in which we narrate our experiences of illness. And it discusses how narratives shape our experience of painful facts into intelligible and meaningful forms, especially when pathographies are written. People affected, people who undergo a certain kind of painful experience, or relatives who witness this particular kind of experience, when they write about it. So the experience of painful facts are transformed into intelligible and meaningful forms. Otherwise, we really don't understand what it is, what the experience is. So once that is transferred or transformed into intelligible form or meaningful form, such narratives become, such narratives actually help us understand our experiences as well. So medical humanities therefore considers how reading narratives of illness can improve our understanding of what it is like, to suffer and go through an illness, or cope with an injury, what it means to cope with an injury. At this moment, we should also see, something called pathography. I have been using this term a few times earlier. Now, serious illness and injury are powerful events that interrupt the routine flow of our lives. Everything is smooth as long as we are all fine. But that smooth flow of life is, sometimes interrupted when, when we have a serious illness or injury. Now, such experiences prompt many people to shape them into a narrative of an experience of illness. And scholars call such narratives pathographies. They are known as pathographies. And 20th century has seen an expansion of pathographies, which speak about medical treatments of their dear ones, in fact. Not necessarily written by the patient himself, but even by relatives sometimes. And they also speak about the treatment, medical treatments of their dear ones. I'm not going to give you the list of the pathographies. I have a number of them with me. That will take away much of our time, but that became a major area. Actually, many people have written in the 20th century. Now, in the 1980s, the genre expanded, and you have memoirs of dying still continue to memoirs of dying still continue to dominate. People who are about to die, people who are waiting for death, their memoirs, or once they are affected by a serious illness, when they know that they may have only maybe a year or two. Some of them have written such memoirs, their experience, their psychological experiences, physical experiences, and so on. So this became, so the genre actually expanded in the 1980s. According to Anne Hunsaker Hawkins, according to her, pathographies interpret experience, and they do so in a way that discloses certain important mythic attitudes about illness and treatment. Of course, when they write, they might use certain attitudes which are already prevalent in the society about illness and treatment. That may be the way they actually approach the experience of illness. But mythic thinking of all kinds becomes apparent in that delicate autobiographical transition from, I'm quoting from her, from actual experience to written narrative. Since this transition is one that constructs necessary fictions out of the building blocks of metaphor, image, archetype, and myth. And these are the tools or techniques that the writer would use. Metaphors, images, archetypes, and myths, and through which you are able to understand the experience of illness. Otherwise, the experience is never communicated. Since we are familiar with this tradition of literature, with this tradition of writing, when the writer uses the already existing methods and tools, it is communicated to the readers, according to Hawkins. Now, Hawkins' book analyzes how authors of illness narratives, her book is titled Reconstructing Illness, Studies in Pathography. That's her book, published in 1993. Now, this book analyzes how authors of illness narratives rewrite their story in the light of received wisdom. And they rewrite their story in the light of received wisdom means by using metaphors of journey and battle, which is an oft repeated or oft used image. The journey and battling with life, right? That's what we say often. So the image of battle and journey, the myths of death and rebirth, and they use all this. They use all these all these images, thereby taking their story from harsh facts to intelligibility and meaningfulness. So if they just present harsh facts, that becomes unreadable. A reader may not be able to read that. But once it is presented through images and the archetypes that are already prevalent in society, it becomes intelligible and meaningful. That's what Hawkins would argue. So her position is that studying pathographies helps to bring the patient's voice in patient-physician encounters. So when a patient and physician encounter each other, when they confront each other, pathographies can actually play a great role. If a doctor reads pathographies, it helps the doctor in understanding the patient's voice, what it is to be a patient. There are people who have also, a number of others who have actually discussed this link between literature and medical humanities. I'm not going into those details because that will again take away much of our time. So in this context, a medical humanities perspective asks a number of questions, such as what is it about illness that prompts the impulse for reflection? What is there in illness that makes you reflect about it and write about it? What are some potential benefits of writing about illness? How and in what ways does narrative have the potential to heal? Does narrative have a potential to heal is another significant inquiry. So apart from narratives of illness, medical humanities is infused with perspectives from cultural theories as well. It critically looks at visual media representations like doctor shows, for example, disability and so on, such shows on visual media. It critically looks at such representations. In fact, pop stories or police stories, you have many such films, right? And doctor stories, they have always attracted a huge audience in the world of cinema. You have doctor, patient, then police stories, you have crime is committed, and you have detective kind of films. These films have always attracted audience in the world of cinema. If police stories mostly deal with murders and deaths, doctor stories are often about saving life. One is about death, murder and death, and the other is about saving life. And naturally, we human beings are forever fascinated by these two extremes of life. These are two extremes of life, murder and death, saving life, two extremes. So we are all perennially, continuously, we are always fascinated. So medical humanities would inquire how such portrayals of patients and doctors make questions of bioethics more accessible and immediate or urgent. So when you have such portraits of patients and doctors, how it raises, it also, along with that, it brings to the forefront questions of bioethics immediately. How ethics is practiced in medicine. You have, maybe some of you may have your own personal experiences or experiences of relatives where, you have been cheated by the field of medicine sometimes, and about, most of us know, many more accessible and more immediate. That kind of a thought is brought to the mind of the audience that it becomes important. Now, it also critically looks at the ways in which disease and its experience is portrayed. How disease is portrayed, how the experience is portrayed. And those of us who are in literature, especially in English literature, I don't know how my audience is right now here, how heterogeneous the audience is, but since I belong to this discipline of English literature, we are all familiar with William Carlos Williams, right? The poet, an American poet. He's associated with modernism and imagism and all that. Now, I don't know how many of us really know that he was a physician by profession, or how many of us have really tried to inquire into that. He was actually a physician by profession, and he has written, we study his poems, of course, but he has written a number of doctor-centered stories. William Carlos Williams was also a story writer, and very few of us would know that, I think. I never had the opportunity to study, throughout my education. I never had the opportunity to study his stories, but I came across his doctor-centered stories only after, I started reading about medical humanities, actually. So he has written a number of doctor-centered stories which throw fresh light on doctors' sensitivity and sensibility, and on doctor-patient relationships. Wonderful stories, actually, because he himself was a doctor. And his stories are available in this collection called The Doctor Stories. That's the title of his collection. And it's compiled by Robert Calls, and it was published in 1984. And in the writings of many physicians, we find a desire to rethink on what they practice. When many physicians actually write, when they begin to write their autobiography sometimes, or when they, whatever kind of narrative that they produce, there is a tendency to rethink on what they practice. So caring for patients and then reflecting upon and writing about their experience is an attempt to discover a required sensibility, a sensibility that is otherwise, or we hope, a sensibility that humanities would provide, probably. So let me now request you to look at what happened to many medical students in the United States in 1960s. Actually, I know I'm taking away much of your time. Please bear with me. Just a few, maybe some 10 minutes more. That's all. So in the 1960s, many medical students were actually dissatisfied with what was happening, in the medical profession, because many of them found the medical school culture as complicit in the injustices of the healthcare delivery system, in which care was considered a commodity. So they felt that care or healthcare has become a commodity. So they were really unhappy with it. In this context, I would like to share with you a poem written by a medical student in Philadelphia in the 1960s. Now, the poet's name is L. Cron. It was a female medical student. Can you please show that? I've already sent it to the organizers. Can you please
sure.
On Being Poor, the poem?
All right. Yeah.
I hope you are able to see the poem, right? Okay. So here she's actually speaking about what happens to the poor in this commodified healthcare system. Being poor is watching all the residents practice passing a laryngoscope down your dead baby's throat. You will be a mute witness to that. Being poor is being told in front of 115 people that you are a veritable museum of pathology. Being poor is coming to the emergency room at 10:30 a.m. with severe pain and not being seen until 1:30 p.m. in the clinic. Being poor is having 4 young men put their fingers in your vagina and only one of them has his name end in MD. Everybody else is studying. So the insensitive manner in which medicine is practiced, or at least taught, that's what she's speaking about. Then being poor is having a med student stick your arm 7 times unsuccessfully while a staff physician stands by and watches. Being poor is being called stupid because you do not have the sense to feed your 5 kids more protein when you get only $3,100 a year. Being poor is being afraid to go to the hospital because you do not want to die. The last line is very interesting. Being poor is being afraid to go to the hospital because you do not want to die. So this was written by a medical student, actually, L. Cron. Now, there were many students who felt the same around this time. They were all against this became critical of an education system that was better at training disease technicians. They called it disease technicians. The medical system was actually training, or it was actually providing an education system which they called disease technicians, rather than educating thinking doctors. So instead of educating thinking doctors, or instead of producing thinking doctors, they were actually producing disease technicians. As a result, by the 1980s, there were many within the field of medicine and outside it who expressed skepticism about this continuing emphasis on bioscience and technology alone as adequate preparation for the practice of medicine. They called for the integration of cultural learning into medical education. So medical humanities was an attempt to address all these issues in medical education. In fact, medical humanities has further developed much, because you have a whole area called critical medical humanities now, even after medical humanities emerged, you have a whole range of scholars known as critical medical, I mean, they are into critical medical humanities scholars. And people like Anne Whitehead or Angela Woods, these are all people who are engaged in the area of critical medical humanities. And they also criticize conventional medical humanities or the mainstream medical humanities. They call it the first wave, and the critical medical humanities as the second wave. And here uh, they talk about embracing new historical, cultural, and political perspectives, as well as different questions and methodologies, and how these are to be incorporated into medical humanities. And they also speak about gender, class, race, sexuality, and so on in understanding a patient. A patient is not simply an individual, according to them. A patient is a woman. A patient could be a black man. A patient could be a lower class, lower caste man, and so on and so forth. So all these, issues that we today discuss in the field of humanities, particularly, in cultural studies, these things have been incorporated into medical humanities by critical medical humanities scholars. Now, I request you to see two short clips from a film called, The Doctor. The Doctor was a 1991 English movie where the doctor is a leading surgeon in a hospital, and his name is Jack, and he works hours and he rarely has time to even take care of his family because he's so much into his medical profession. But his bedside manners, when he goes to see the patients, or the way he treats his patients who are seriously ill, and that he is very insensitive. For him, he's just a patient. Somebody is just a patient, and he has been dealing with patients for so long. And what happens is, he is diagnosed with cancer later on. And look at what happens. His reaction after that.
And are also rooted culturally, historically,
Okay.
and how it has been treated and represented. Also, the negative and positive impact of films in the medical profession. You also spoke about an intellectual movement in all the.
You are stuck.
Discipline of history of medicine, wherein in London, medical students were expected to be well versed in multidisciplinary subjects because the main vision was to be humane, and the medicine, they have to be humane. So I take this opportunity to thank you for this insightful session. I would request the participants to switch on their video for a photo session. And after that, we'll have a Q&A session. Dear participants, please switch on your video. Okay, so the session is open, and there are a few questions already, I guess.
Yeah.
So you have two questions. Is sensitivity essential for a medical practitioner?
Okay. I mean, I would say definitely. Otherwise, an insensitive doctor. Imagine consulting or meeting an insensitive doctor or an insensitive, nurse, who comes to your room every day. I mean, how pathetic it would be. I think part of your healing also depends on the way they actually interact with you, the way they patiently listen to you. Okay, your experiences, what you feel, and the difficulties that you face. and how patiently they should actually listen to you as a patient. That I think that is essential. I don't know how many would disagree with that.
Correct. Right. So there's one more question.
Yeah.
So can you please talk about fact studies and its connection with
Okay. Yes. I
medical
saw,
humanities?
yeah, I saw that question. Of course, definitely. I mean, it's not that fact studies emerged because of medical humanities. I wouldn't say that, definitely. But you can use a lot of inputs from from medical humanities while carrying it out. For example, fact studies is also a central part of cultural studies nowadays. Especially the way, and it is also linked to gender studies to a certain extent, because especially in America and in Europe, how the whole image of the fat person is often female, and a female fat woman. So obesity studies, in other words, you can also think about that too. And so how gender studies scholars would say there is a way in which the whole thing is represented. It has a patriarchal agenda behind it and things like that. And now that is all there. But at the same time, the whole understanding of beauty, how a physique should be, how a body should be. For example, a person like me would be made fun of probably, for being very lean. What it is to have an ideal physique, an ideal body. These questions are questions of cultural studies, definitely questions of cultural studies. But then, the moment you talk about shaping your body, you are slowly going into the area of medical humanities as well, because it involves practitioners. And how they tell you, it's almost like sometimes it's almost like Fair and Lovely telling you your body is not perfect. We'll make it perfect. Only if you use our products, it'll be perfectly fine. It's like that. Sometimes doctors also tell you. And there is a curious kind of connection between, in that sense, medicine and medicine and the kind of treatment that is carried. So once you're talking about treatment, the ways in which you are actually shaping your body, the ways in which you approach the whole issue. If you see fatness as an issue that needs treatment, then you need to go into the area of medical humanities as well. Otherwise, it's mostly a part of, I would say, cultural studies.
But sir, I personally feel that the medical system, the whole medicine system, they are negatively influencing people. Like there's so much of plastic surgery happening, and people are so much obsessed with being thin, sleek, slim, fair. So, so there is a connection.
Yeah, definitely. I agree with that totally.
Yeah.
That's why I said the doctor is doing the work of Fair and Lovely, actually.
So that is the commercialization. You spoke about commercialism and all that. Thank you so much for answering all the questions, sir. Dear participants, the feedback link will be posted in the chat box.
Saujanya, one second. The feedback link is already posted in the chat box.
Okay.
Yeah. Kindly fill the feedback form. Yeah, immediately.
Yes.
After half an hour, the system will not be accepting. The form will not be accepting any responses.
Okay. So please do it as soon as possible. Okay.
I have a question. Sorry, I have a question.
Sure.
Yeah. What is the difference between illness, disease, and disability? How would it define?
I think I differentiated between disease
illness
and
illness. Yes.
Yeah. Well, disability is, that is something different, because you cannot actually, I don't know if you can actually bring all the three together always, because a disability often is the inability or the problem that a person faces, or the person feels that he or she is very different from the rest of the society or people in the society, or the society also feels that so and so is very different from he or she cannot perform the way we actually do, that kind of a situation. And there could be very genuine physical reasons for that sometimes, or even psychological reasons for that sometimes, for being disabled. But illness and disease would be slightly different, because that is something that happens to you at some point, and you treat it and you recover from it, right? This is something that you treat and recover. But as far as medical humanities is concerned, I mean, both illness and disease could be one and the same, but medical humanities would distinguish between illness and disease in the sense I told you earlier, that disease is something that happens to the body, which requires treatment, whereas illness is something else. The experience of being ill or being, affected by a disease, that kind of a situation. I don't know if all the three can be, easily clubbed together.
Okay. Does the discipline of disability studies intersect medical humanities?
Definitely.
It does. Then if someone is working
especially with the emergence of critical medical humanities, they're actually speaking about, they're not simply talking about only gender, race, class, and things like that. They're also talking about disability. So because, it is not simply a body. That's what they are saying. Mainstream medical humanities field has always looked at, patients as patients, but the patients are not simply patients. The patient could be a woman, and therefore the experience of a particular illness might be different. Might be different means how, if a woman is diagnosed with something, and if the head of the family man is diagnosed with something, the reaction to it could also be different, by the family members, by the relatives and all. I mean, I'm just giving you an example through this. So a patient is not simply a patient, but according to them, conventional medical humanities or mainstream medical humanities has always looked at patient as patient. Okay, but you have to see a patient from the gender studies perspective, race studies perspective, probably, or even the issues of caste, class. All these things become important. And similarly, therefore, when you are approaching disability studies, if you are talking about people with disability, persons with disability, a person with disability is an altogether different category in society, in the eyes of the society. It's a different entity altogether. So his body is not like any other body, in other words. It's just, again, he is also not just a patient. That's the point there. So at that point, critical medical humanities would definitely include disability studies as part of medical humanities. So inputs from disability studies would that way enrich medical humanities, in other words.
Thank you, sir.
Yeah. Any other questions?
Somebody has asked a question.
Okay.
Do you think robots will be able to help us to cope or stress efficiently in our life? I don't know. I can't really answer. I mean, as of now, I don't believe that robots can. Maybe in future, we don't know. Once they start thinking, if robots begin to think and react, or if they are endowed with emotions, human emotions, maybe. I mean, we have tried it in our aliens type of movies, actually. Where aliens actually react almost like human beings. We don't know whether there are aliens or aliens would react that way. But we are able to understand such films because they also react exactly the same way human beings react, right? They get angry, they attack you, and all that. We really don't know because they are also endowed with human emotions, in other words. That's why we are able to understand it. And tomorrow, if robots are endowed with emotions, maybe possible. We really don't know. Then there is another question. Yeah.
Yeah, there's also a question that, sir, isn't mental illness considered here?
Yeah. Definitely. Medical humanities would definitely consider mental illness as well. That's a very significant area, actually, because that's where a lot of isolation, segregation, and all that happens as I mean as a patient. Definitely part of humanities.
Correct. Are we done? Okay.
Question, sir.
Yeah.
Can LGBT community be considered to be a part of medical humanities studies? They
I
have
don't.
biological
I
disparities, right?
Because it cannot be treated. I don't know whether we can actually treat it as an illness. It's not an illness, right? So, but definitely, you know, such psychological temper, if medicine and psychology go on to argue that it is something that needs treatment and all that, then definitely medical humanities would question such a.
Nowadays, so many people are getting treated, right?
Yeah.
So again, would that be considered
Treated for, you mean?
for changing? So many things are there.
Oh, that way. Okay. Medical, medical, transformation.
Also mental illness also. It's like
Yeah.
Anxiety, stress, depression. They
Oh,
also
okay,
get
definitely medical humanities
Yes.
would. I haven't looked at that area, but definitely it would be part of medical humanities in that sense. Definitely. Absolutely no doubt.